Hi everyone! Today we will talk about teenage pregnancy. Let's watch and learn.
Most teenage girls don't plan to get pregnant, but many do. Teen pregnancies carry extra health risks to both the mother and the baby. Often, teens don't get prenatal care soon enough, which can lead to problems later on. They have a higher risk for pregnancy-related high blood pressure and its complications. Risks for the baby include premature birth and a low birth weight. If you're a pregnant teen, you can help yourself and your baby by getting regular prenatal care, taking your prenatal vitamins for your health and to prevent some birth defects, avoiding smoking, alcohol, and drugs, and using a condom if you are having sex to prevent sexually transmitted diseases that could hurt your baby.
My name is Musao Kate. Today, let's talk about teenage pregnancies.
Teenage pregnancy? What about it?
First and foremost, let's talk about what it is. Teenage pregnancy is when a girl below the age of 20 gets pregnant. For girls, their first period is a signal that they may be fertile and able to get pregnant if they have unprotected sex. For boys, around when they start puberty and sometimes have wet dreams, they begin producing sperm and may be able to conceive a child upon having unprotected sex. That means without using contraception. It is important to know that having a baby is a lot of responsibility. Ask yourself, am I ready to be a parent? How will I manage being a parent when going to school? Do I have enough money saved up to pay for things that the baby will need? In addition to that, it's helpful to understand the risks associated with teenage pregnancy. Risks? What risks? Having a baby before the age of 20 can have negative consequences for the health of the mother and baby. Teenage mothers are at increased risk of experiencing birth-related complications, including fistula and obstructed labor, and their newborn babies are more likely to be born premature. There are also social consequences like having to leave school and friends behind. Waiting just a bit longer until your 20s can help you finish school and reduce these risks to ensure a healthy pregnancy and birth.
Okay. How then do we prevent teenage pregnancies?
Knowledge and education are the first steps to prevention. When curious about relationships and pregnancy, talk with your parents, guardians, seek out information from a healthcare provider, a counselor, sexuality education teacher, or other trusted adults. Staying in school is also key, along with accessing sexuality education, which can provide skills and information about ways to prevent pregnancy. The only way to prevent pregnancy 100% is abstinence, which means not having sex. When you don't have sex, there is no risk of getting pregnant or getting sexually transmitted infections.
So Kate, are there other ways of preventing pregnancy and infections?
Yes. If you are sexually active, using a condom correctly and consistently is the best way to prevent both pregnancy and STIs, including HIV. There are both female and male condoms on the market. When using a condom, it's important to use a different one for each sex act and dispose it off properly. There are other contraceptive methods on the market, such as injectables and the pills that can be used to prevent pregnancy, but that don't prevent STIs. A person's preferred method is based on their personal physical and emotional needs. There are different ways of preventing pregnancy. With help, you can figure out what's best for you, as it's different for everyone. understand that it's okay to wait until you are better prepared emotionally and physically to become a parent. You can make the decision now to prevent pregnancy and reduce risks that come with early pregnancy and childbirth. Remember, the only way to prevent pregnancy and STIs, including HIV, is to abstain from having sex.
Wow. Thank you, Musao Kate. This was very informative.